right, it's 8 o'clock Eastern Standard Time, and it is go time. We are going live tonight with the amazing Dr. McCann. We're going to go ahead and start waving at some of our friends and say hello, good day. Today was a long day, but we're going to have a lot of fun. So we're just waiting. Yo, what's up, DJ Tight? Tight's in the building. Jally's here. Oh, it's going to be fun. Waiting for Dr. McCann. We're going to wave at Gina and boom. She is coming all the way from Denver, Colorado. The amazing Dr. McCann. How are you?
I'm good. Just right before I went to log in, Instagram was like, you have to confirm your account. Please enter the code. I was like, really? I haven't done this in years, and you're asking me to do it right now? But we're good.
They just want to make sure that it's you, you know. They saw the flyer. They want to just make sure it's you.
Yes. Well, thanks for having me.
No problem. I know you're super busy, and the fact that you're able to join us here, Chairside, is amazing. We're going to go ahead and get straight to it because we've known each other for so long. I know we're going to go way over time, so I want to get the party started. Dr. McCann, can you tell our amazing audience who you are?
Sure. So I'm Katie McCann. I am a dentist practicing out of Aurora, Colorado. I'm originally from a small town in Illinois, went to school there. And then I graduated in 2010, which is now so long ago. But I moved out to Colorado immediately after graduation, and I've been practicing there ever since. I am a partner with Pacific Dental Services. So currently I support over 80 practices with them. And then I work with you in Florida, in South Florida. I'm in Central Florida, Georgia, Colorado, New Mexico, Idaho, and Utah. So lots to do.
Wow. So that means you never have a dull moment. You always have something to do. 80 practices. Wow. What made you want to, practice dentistry this way? Because that's a lot of practices.
Yeah, it was really unintentional, to be honest. I grew up in a small town, and we had a dentist, like a local community dentist, and I worked for him. And the idea was always to graduate school and come back and take over his practice. And when I graduated, he wasn't quite ready to retire yet, and I wanted to get out of the cornfield. So I said, I'll move to Colorado for 2 years, and then I'll come back and buy your practice. So that was always the plan. But then, within just 6 months, I think I bought my first practice with Pacific Dental, and then I bought 2 more before my first year out of school. And then I teamed up with some really good mentors along the way, and just started focusing on coaching and mentoring doctors. And then it's kind of just spun out of control. I didn't even realize, how many I owned until just recently when I had to do my taxes. So.
Oh, wow. That is amazing. So with 80 practices, that's well over 80 associates that you're mentoring. I see it in your eyes. I remember when you started with me.
Do you see these bags, or have I covered them up appropriately?
I remember when you started with me. Actually, the first day I met you was the day I was hired here at West Sunrise Dentistry. I did my interview on a Saturday. I think you were working with like at least 5 other docs here, mentoring them. You were doing anterior crowns and veneers. So I was like peeping, trying to see exactly what was going on. And I saw you running from room to room. You popped in, did my interview, said a couple words like, yep, hire him. He's good to go. And I was like, okay, who was that lady? And later I found out, the boss you were. And it's just, an honor to even be in your presence sometimes because of all the things you do. So going back to mentoring, can you give us some tips that you have for the multiple associates you have in all of these offices?
Like for tips for the associates, or?
Yes, tips for the associates. Yeah. How do you handle so many?
Yeah, so I think, in terms of tips for associates, so what impressed me about you was, you told me about your family and how you're motivated to provide for your family. So I love that you had a bigger mission that you were trying to accomplish. The other thing that you've always said to me is you always say, tell me how I win. Tell me what I got to do and I'll do it. And I think that's so important for people to understand these days, is that yes, we're doctors when we graduate, but there's so much that we have to learn, and you can always learn something new from someone else. So if associates could come out and remain being humble and hungry, I think it would really help them in their trajectory. The other thing that's really important for associates is, you know, in school, we're always taught to follow the research and do what the research says, and you know, practice evidence-based dentistry, which we absolutely should. But sometimes clinical practice can alter a little bit from that evidence. So if you have someone in your practice telling you that this is the best way to do something, it might not always be a good idea to try and challenge and reinvent the wheel. Sometimes with associates, I find so many people just, they're always trying to, you know, I'll tell them, hey, look, you might want to diagnose this or treatment plan this based off of what I see. This is what's happened in the past. And they'll say, I understand what you're saying, but I'm going to go do it my way. You know, and then we know how that turns out, and it ends up failing. And what impressed me about you is you always just say, Doc, what do I got to do? Tell me what I got to do and I'll go do it. And so I think people can shorten their ramp time and their development time if they would just listen to the, you know, plethora of knowledge around them from great mentors.
That makes me think back when I flew out to Denver to check out your office. Literally, I was just walking around and, in my words, peeping game. I saw exactly what you were doing. And so you made it so clear. You're like, we do our morning huddle. I speak to my my associates. I have a separate meeting with them. I talk to my lead assistant, and then we go to work. So, you know, you kept it super simple. You came in, took care of business, and your patients were super excited. And it's like, all right, let me go back to my office and repeat, you know?
Yeah.
I always try to, you know, learn from others, because if you're going to bang your head against the wall and, you know, get all those lumps, I should learn something from that, right?
Yeah, I always tell people I've already made all the clinical mistakes that are out there. I've already made all the leadership mistakes, the boss mistakes. Like, let me just tell you what not to do so you don't have to go through those aches and pains that I have. But you brought up a good point with, you know, I forget what the quote is, but it's something like, you know, an ounce of preparation will save you, you know, a lifetime of headaches or something like that. So you're absolutely right in the fact that I am very structured in how I run my day. I do meet with my team every morning, and my team knows, you know, you better not be late to DMC's huddle, because that's how we start our day. You know, if you start off in chaos, you will never recover the rest of your day. And I stay very closely connected to my associates, my lead assistant, my manager, because they're the ones that are running the operation during the day while I'm seeing patients. So it's important that we're all aligned and that we have a game plan for the day.
Exactly. All right. Now, going back to mentorship, I know that's one of your huge, huge pushes. Why is mentorship so important to you?
That's a great question. You know, I think it's important as I'm getting older now, right? I've been practicing 11 years. I think it's important to be part of something bigger than yourself, you know, and what I found over the years and what I've learned is that the more that I help other people succeed, the more I succeed. And that's the honest to God's truth. I was talking with one of my hygienists today. You know, you got to think about giving first before receiving. I read a book a long time ago called The Compound Effect. And in the book, it says something to the effect of your value or your worth is proportionally related to the number of people that you can impact. And that just really, I remember I was on a plane. I was probably traveling in Florida or Georgia or one of the two. But I remember that just like hitting me like a ton of bricks. And I realized, you know, I'm very passionate about clinical excellence because of my backstory. And so I really want patients to receive the best care. And I know that I can only treat so many patients. There's just so many hours in the day, and there's only so many days I can work before my neck wants to break. So that was the day that I decided, hey, if I can go out and mentor other doctors to be better professionals, better leaders, better clinicians, I am impacting thousands of more patients than if I were just doing it on my own. So that really is the drive behind mentorship.
All right. And I know you have these moments like a million times a day because you're dealing with so many docs. But what is one super cool, amazing, aha mentoring moment you can think of off the top of your head?
Well, I was actually going to tell the story about you, about when I hired you. You know, every time I see you with your notebook and you're like, what do I got to do to win, doc? Just tell me. Do you remember when you wanted to buy that desk when you became the owner doctor. You
Yes.
sat down in your office. You know, we weren't where we wanted to be financially there yet, you know, and you said, I want to buy a mahogany, I don't know what it was, mahogany desk or some sort of big boss desk. And I was like, okay, bite your tongue, take a breath, you know, walk him through it. And now it's like, we don't even talk about that anymore, right? And I think you won Most Improved Office of the Year, and you're absolutely crushing it. And you have your own Instagram live podcast going on. So, I mean, you're just crushing it. You're a huge success.
In my defense, I needed that desk so I could do more activities. I needed to write things down, hold notes, but we found a nice compromise, and that's something I also picked up from you.
Yes,
Compromise.
go to IKEA. Don't buy the expensive solid wood desk.
Oh,
and I think I told you, I said, you shouldn't be sitting at your desk anyway. You should be cutting crowns. You don't need a big desk.
You know, I tell all my associates that now. Why are we sitting down? We shouldn't be sitting down. There's so many patients that need help. Let's go ahead and get out there and help them.
Exactly.
So, Doc, here's another question. What made you go into dentistry? You have an amazing story, and I think you should share it with the world tonight.
Yeah, and I don't know why I haven't really shared it in the past. I've been sharing a lot of it recently. But when I was 14 years old, I was in a four-wheeler accident in my hometown. So I was riding on a four-wheeler. ATV is also another name for it. I didn't have a helmet on that day, and I ran face first into a telephone pole going 30 miles an hour. You know, typical me, I get off the four-wheeler and walk to a neighboring house for help, ask them to take me to the hospital, tell them not to call the ER because I was afraid I was going to get, or not to call the ambulance because I was afraid I was going to get in trouble from my parents. You know, told my dad on the phone it wasn't that big of a deal. I think he finished mowing the lawn. Like, here I am being carted to like the ER, and my dad's like, oh, let me just finish mowing the lawn. You know, obviously they'd be horrified of everything that happened now. But I ended up fracturing pretty much every bone in my face from my eyebrows down. I had my jaw wired shut for 2 months, and when they took the wires off, my jaw was completely fused shut. I could not open at all. I broke a bunch of teeth. I lost a couple of teeth, and it took 4 years and 9 surgeries to get my mouth to open again and to reconstruct my face. So my right condyle is actually my rib bone. So they took out my rib, put that in there. I think I have some cat cartilage in there for the disc. I posted some CBCT images the other day of pins that I have kind of going everywhere. My eye socket is reconstructed. And then I had my upper and lower jaws fractured and reset twice. And then because my mouth was, you know, I couldn't open for a couple of years at all because I didn't get my rib surgery until about my junior, senior year. I couldn't take care of my teeth, right? And I had all these broken teeth, and I was missing teeth, and I had to wear horrible flippers to high school. That half the time I left the flippers at home, and my friends would see me without front teeth. So it's pretty horrifying. But, you know, once I got my jaw to open up, my dentist was able to restore my smile. And that really was life-changing. Like, I remember looking in the mirror and having a full set of front teeth again, and it was everything, you know? So I just decided I wanted to be able to do that for other people.
Wow. That is definitely life-changing. Wow. I didn't know all that.
Yeah, I know. I don't really talk much about it. I think I'm always just used to like doing dentistry and going down that route. But yeah, I'm sharing more of it now. I should talk about it more for sure.
Definitely. I saw the CD that you posted online, and the fact that you put all your work right out there, that's amazing. And I saw some implants, and I know how much you love implants, all on X. I have a couple of my assistants watching. They wanted to ask you, why are implants so important to you? And they also want to know, when can we get that at Sunrise?
Hey, I'm just waiting on your support team there in South Florida to let me come down. I'm ready to go. We have some courses that we're already launching. So, you know, my passion for implants came from my accident, right? So I was missing a bunch of teeth. This was back in 1998, and in a small town, like, implants were not a thing. So we had to travel, you know, a couple hours for me to get the care. They didn't really do bone grafting back then. There was no surgical guides, no CBCT. So I was able to get an implant on top. And at the time I had just a bridge on the bottom because I didn't have enough bone. Now you can see from my CBCT, I have an implant on the bottom too. And my dentist actually, he had never restored an implant before. And unfortunately, you know, he didn't restore the implant with the right components. Did the best he could, but I had a chronic draining sinus tract from the facial of the implant that ended up spreading to number 11, and I ended up losing number 11, which you can see in my CVCT too. But despite all that, my implant is there. It works. It's solid. And it really transformed my smile and helped me save other teeth in my, you know, other teeth of my smile. So I've seen firsthand the impact that implants can have on your life. And that is why I'm so passionate about everyone getting implants or being trained on implants. The other thing is my family had, you know, I'm from a blue collar family. My parents worked very, very hard. You know, my dad worked swing shift all the time to support our family. And because we didn't have access to care in our small town, they had to drive me all over the state for me to get care. You know, and I think back in what a sacrifice they made, right, for me to get the top quality care. And I don't, you know, in this day and age, we're in 2021, patients should not have to be driving multiple hours to see a specialist to get an implant done. So my mission is I want every GP in America trained to place implants. That's what I'm going for, and I'm on it.
And if you said it, it shall be done. So
it shall be done. Just give me a few years, but I'm working on it. Yeah.
Oh man. So you're gonna make that happen. You have a million offices. You deal with knuckleheads like me every day. So I know some days are tough.
Yes.
And those days get tough and stressful. What does Dr. McCann do to unwind?
Well, wine is very good. I will say that. Yep. I have two pugs that I just like, I'll come home at night and literally just lay on the floor when I get home and just let them kiss my face for like a good 5 minutes. That's always a good way to end the day. But you know, it's very rare that you'll ever see me kind of sitting down and chilling. I'm not like a binge watcher or anything like that. My husband and I, we love to be outside. So on the weekends we go snow skiing. And in the summer, we're mountain biking or hiking every weekend. We love to travel too. You know, it's been kind of hard with COVID. We usually take some pretty big vacations every year, and we haven't been able to do that. But hopefully we'll be able to get back to doing that soon, because we love to scuba dive and see new cultures and things like that. So
one of my favorite vacations via your Instagram was when you went to Egypt. I really want to go to Egypt, and the amount of pictures you posted, I felt like there. So thank you so much. I was on that vacation with you.
It was a dream come true. You know, when I hired Dr. Gadd several years ago for South Florida, he was Egyptian, and he told me his family still lived in Egypt. And I said, I'll hire you on one condition. And he said, well, what's that? And I said, you have to take me to Egypt with you. And I'm sure he thought I was like a psycho, right? Like he doesn't even know me. But a couple years later, you know, we became good friends, and he took my husband and I to Egypt, and it was a trip of a lifetime. We had the inside, you know, hook to everything. It was really cool.
So we see how you unwind. We see what you do. Now, if you had a young doc and they were in the midst of somewhat of a meltdown in the office, nothing crazy, but, you know, just the everyday dental, what are some of the things you would say to this doc to kind of get them back on track?
I had my fair share of meltdowns. Like, let's just start there. You know, I think any high performing professional will put themselves in a situation where they get uncomfortable and have a meltdown, right? If you're not uncomfortable, you're not growing. You know, you don't just go out and run a marathon one day, right? You have to train and build up your endurance, and you have to get uncomfortable in order to get gains. It's the same way when you're practicing dentistry. You know, if you just want to run a 1-column schedule and see, you know, patients every 2 hours, like, that's not getting uncomfortable, right? That's not going to challenge your clinical skills or your patient management skills. So I'll tell them that this uncomfortable feeling is good, because it means that they're getting better. The other thing that I tell them is you need to get used to this feeling, because if you're not feeling uncomfortable every day, you're not pushing yourself hard enough. You're not reaching your potential. So I let them know that it's okay to be in this position. That's the first thing. The other thing that's really important is to remind them that luckily we're in a profession where almost everything that we do can be fixed, right? So we have the privilege of, you know, we don't work in life and death situations most of the time. You know, if they're having a meltdown because they sent someone to the hospital, that's a different story. But most of the time it's a meltdown because, you know, crowns aren't fitting or a patient's upset or, you know, one of their implants is failing. So just reminding them of, hey, look, failures happen. If you haven't had a failure, it's because you're not doing enough dentistry. So let's take a pause, lift up, see how we can fix the situation, be happy and grateful that we feel uncomfortable because it means that we're getting better, and let's move forward.
Beautiful, beautiful. Wow. So my next question, what motivates you overall, Doc? You're gonna keep doing all the amazing things, but like what just keeps kicking every day?
Yeah. I mean, you know, the cheesy answer is clinical excellence. Like, I think you know that too. And when I say it, like, I'm not trying to be cheesy, like, you know me, like, I am maniacal about clinical excellence. You know, another part of my story was the first part of my surgery with my accident. Unfortunately, the doctor who operated on me didn't do a good job. And that's why my jaw was fused shut. And it took 4 more years to fix it. And so I don't ever want to harm a patient, right? And so that is the motivating factor behind everything that I do all day long is how can I give patients the best, you know, care possible, and how can I train doctors to do the same? Because I don't want anyone to be in a situation like I was. The non-cheesy answer is I've realized over time working with mentors that I am addicted to accomplishment. I love checklists. I love checking them off. I love accomplishing goals. I love winning. You know, when I was a kid and you would go in my bedroom, I would have every certificate and award and medal hung on my wall. Like you couldn't even see the wall or the paint because everything was covered with like stupid certificates, like, you know, attendance, like, you know, that everybody got. But I love, yeah, completed the PE 10-mile or 10-minute run or whatever it was. But I love accomplishment because I feel like I'm gaining something. You know, I'm getting gained. Sorry, my old dog is in here, so she's coughing. So accomplishment definitely motivates me for sure. I like to accomplish things.
I remember when we were at the XP Award show and you won Office of the Year. And like that's always stick with me because I want to win that award. And I saw like pure joy in your face when they said that you won. And then after you won, you looked at John, I believe, and said, "It's about time." And so things like that will always stick with me because I know how hard you work. And that was the pure, unfiltered version of yourself. And I love to see that in people because that shows everyone you're human. You work just as hard as everybody else, and you want that accomplishment. And now that you shared that, I bet you your trophy's just sitting right there in the office.
Oh
just every day.
For sure. Yes, I have all of our trophies everywhere in our office. It's pretty obnoxious. But no, it is about the accomplishment, and it's about the team too, right?
You hear her sound? Your sound.
You know, the year before is the year that I thought we would win and we didn't. And I remember crying and my husband was like, "Why are you so upset?" And I said, "I feel like I've let my team down." And I was so defeated, and I cried in huddle Monday morning when I had to tell them we didn't win. I mean, it was for them, you know? So when we won, I was like, yes, like it's about damn time that my team is recognized. So yeah, it was really cool experience for them.
Oh, all right. So we're going to go ahead and open up the question section because me and Dr. McCann could do this all night long. I remember one of the questions was, what's your favorite wine? Can you tell me about your wine of choice?
Yes, Tempranillo. It's a red Spanish wine from the Rioja region. A couple years ago, my husband took me there so I could taste it firsthand, straight from the vineyard. But it's very, very good. It's kind of like a Cabernet, but from Spain.
All right. All right. I have a question in regards to dentistry. Um, the patient says, I have a question. I hope you can answer it. I had a root canal surgery. However, I still felt that a small balloon exists. And when I press it, it hurts. The dentist reopened it. What should I do?
Yeah, I mean, you should never have any kind of balloon on the gum tissue, right? That typically means that there's an abscess somewhere. It depends on how long ago the root canal was done, because if it was something that was recent, you know, those lesions and abscesses can take a while to heal. But what I would do is see a doctor that has a CBCT x-ray or a cone beam x-ray, because they can see inside the root to see if there might be any other live tissue there, or maybe there's a root fracture, but they can give you a lot more answers if they have a more detailed x-ray.
All right. So then I have a question for you, Doc. Are you ready?
Yes.
All right. So you said you have 80 offices. What do you
Yes.
think your top amount of offices is going to be? Are you going to make it up to 100, or are you going to even blow past that and do 200?
Well, I keep saying every year that I'm done. But then I buy another one. I have another one opening in Lowry next to mine here at the end of the year. So, and Florida, you guys are crushing it and you're growing like crazy. So I would say it's your guys' fault, to be honest. If you guys weren't doing such a good job, I wouldn't have to keep buying.
All right, that's a great answer, Doc. Well, I really enjoyed having you here tonight. I promise I wasn't going to take too much time. We're coming up on that 20 to 25-minute mark. Is there anything, Doc, you want to ask me before we go?
Yeah, what inspired you to do this Instagram Live?
Honestly, I was in a meeting and someone asked me, why don't you do any lives? And I was like, I never thought about it. It didn't cross my mind. And so after talking to him, I kind of came up with the idea of trying like a nighttime talk show. And then from there, it just kept growing and growing. And my wife will tell you, once I get that one little idea, it does not stop. So this whole idea and show came up in one night. Like literally, somebody said something to me in a meeting at about 4 o'clock. And then honestly, by 11 p.m., I had everything written out and I was ready to go. So
Yeah, that's so cool. Well, it's amazing. I'm really glad you're doing this.
no problem. I'm glad that you were able to make it to the show. I'm excited to continue to do this, and I want to see you down here in South Florida at some point. So don't
I
get
know.
too
We need to do that implant course. I'm ready. Let's get it going.
I have a patient that harasses me every other day about it. It's
Yeah.
one of my assistants, and I want to do this implant for this assistant, so we got to make it happen.
Well, I mean, if worst case scenario, I'll just come down and teach you how to do it. It's fine.
Yes. Oh, VIP. VIP. I love it. Thank you so much, Doc. I truly appreciate you. You changed my life, and I'm so happy to know you.
Oh, thank you. I appreciate it.
All right. Have a great night.
All right. Bye.
Bye.